Urinary incontinence. Urinary incontinence is divided into three general types. You can potentially experience more than one type at the same time. Stress incontinence. Stress incontinence is triggered by certain types of physical activity. For example, you might lose control of your bladder when you're exercising. Coughing, sneezing, laughing causes in risk factors of urinary incontinence. There are many potential causes and risk factors for urinary incontinence. Some risk factors can include having weakened bladder muscles, which can result from aging, having physical damage to your pelvic floor muscles, such as from childbirth, having an enlarged prostate, having prostate or bladder cancer, which can put pressure on your bladder, having a neurological condition such as dementia, Alzheimer's, or a physical condition that may prevent you from making it to the bathroom on time, having an infection, such as a urinary tract infection, bladder infection, kidney infection, or kidney stone, being pregnant, being overweight, having diabetes, going through menopause. Some of the conditions that cause urinary incontinence are easily treatable and only cause temporary urinary problems. Others are more serious and persistent. Common causes of urinary incontinence may include aging. As you get older, the muscles supporting your bladder typically become weaker, which raises your risk for incontinence. Damage. Your pelvic floor muscles support your bladder. Damage to these muscles can cause incontinence. It can be caused by certain types of surgery, such as a hysterectomy. It's also a common result of pregnancy and childbirth. Enlarged prostate in men. The prostate gland surrounds the neck of the bladder. This gland releases fluid that protects and nourishes your sperm. It tends to enlarge with age. It's common for males to experience some incontinence as a result. Cancer. Prostate or bladder cancer can cause incontinence. In some cases, treatments for cancer can also make it harder for you to control your bladder. Even benign tumors can cause incontinence by blocking your flow of urine. Other potential causes of incontinence may include constipation, urinary tract infections, UTIs, kidney or bladder stones, prostatitis, or inflammation of your prostate, interstitial cystitis, or a chronic condition that causes inflammation within your bladder. Side effects from certain medications, such as blood pressure drugs, muscle relaxants, sedatives, and some heart medications. Some lifestyle factors can also cause temporary bouts of incontinence. For example, drinking too much alcohol, caffeinated beverages, or other fluids can cause you to temporarily lose control of your bladder. These complications may include urinary tract infections. UTIs can be caused by wet undergarments against the skin. This may create an environment where bacteria can grow. Kidney damage. In some cases where the flow of urine is obstructed, you may experience kidney trouble or kidney failure. Cellulitis. This skin infection is caused by bacteria and may cause swelling and pain. Medication side effects. Medications used to control urinary incontinence may cause side effects. Depending on the medication, side effects may include dry mouth, nausea, hypertension, or others. Catheter side effects. If you have a catheter placed, you may experience side effects such as infection and trauma. Mental health side effects. Urinary incontinence may cause feelings of anxiety, depression, or social isolation. What your treatment will involve. Your healthcare professionals' recommended treatment plan will depend on the cause of your incontinence. An underlying medical condition may require medication, surgery, or other treatments. In certain situations, they may not be able to cure your bladder incontinence. In these cases, they will likely provide steps you can take to manage your condition. Treatment options for urinary incontinence may include bladder training. You may be encouraged to do certain exercises, such as pelvic floor exercises are bladder training, which can help to increase your bladder control. Behavior therapy. Managing your fluid intake, adjusting your diet, or using the bathroom at scheduled times before you feel the urge to go may help manage bladder incontinence, depending on the cause. Condition management. If your urinary incontinence is caused by another condition, such as constipation or a UTI, treating that condition may help your urinary incontinence as well. Medication. Sometimes, medication may help, depending on the cause of your bladder incontinence. Antimuscarinics are a class of drugs used to treat an overactive bladder. Catheter placement. If your urinary incontinence is persistent and significantly affecting your quality of life, a doctor may suggest an internal or external catheter to help manage overflow incontinence, or in some cases, functional incontinence. Weight loss. A doctor may suggest weight loss to help manage your symptoms because it can relieve pressure on your bladder. Absorbent undergarments. Using pads or absorbent undergarments, from disposable panties to washable and reusable ones, may help contain smaller leaks. Reducing bathroom barriers. If you're having trouble navigating to the bathroom, especially at night, consider maintaining a clear and well-lit path to help you get there as quickly as possible. You can't prevent all cases of urinary incontinence, but there are steps you can take to reduce your risk of developing it. For example, try to maintain your healthy weight, get plenty of exercise, eat a balanced diet, limit caffeine and alcohol consumption. Avoid smoking. If you smoke, seek prompt treatment for urinary tract or bladder infections.